Okay.
Yes, come in.
Hello, my name is Deborah, and I'm going to be your nurse for today. Can you tell me your name and your date of birth?
Mary Thompson. My date of birth is 02/02/1964.
Okay, can I check your handband?
Yes.
Okay. I'm going to be doing your, I'm going to be conducting a physical assessment on you, and I'll be assessing you from your head to your toe. So I'm providing privacy, giving you a drip up, and I'll go wash my hands and I'll be right back. Okay. Okay. Miss Thompson, can you tell me what brought you here?
Yeah, for my regular checkup.
Okay. Do you know where you are?
Yes, the hospital.
So I'm checking whether you're oriented. And do you have any pain?
Yes, I do.
Where is the pain?
My stomach.
Was when did it start?
Yesterday.
And how is the pain like?
It's I would say it's dull. It's a dull pain.
Okay. And how will you rate your pain level on a 0 to 10? With 0 being no pain and 10 being the worst pain you've ever had?
I'll say 2.
Okay. What works for your pain?
When I do eat,
Mhm.
it gets better.
And you told me it started the last 2 days. Have you taken anything for it?
No.
Okay. All right. I'm going to go ahead and start checking your vital signs, and I'll start with your blood pressure. Do you have any preferred arm that you want me to use?
No.
Okay. How does your blood pressure usually down? The normal level was the normal range?
120/80.
120/80. Okay, I'm going to start right now. Feeling for a brachial pulse. And I got 110/80 for your blood pressure. Okay. I'm going to go ahead and check your temperature, okay? Your temperature is 98.1. And I'm going to check your pulse, okay? Whilst I'm doing this, I'm going to check your oxygen. And whilst I'm doing this, I'm checking your pulse for 1 full minute. Okay. Your pulse is 80 and your oxygen is 97%, okay? Okay. Okay. As I was checking here, I was checking for your respiration, and your respiration is 19. And as I was doing that, I was also checking for the rise and fall of your chest to see if it is symmetrical, and it is. Um, Once I'm done with that, I am going to go ahead and start with your cranial nerves, and I'm going to be checking for your sense of smell, your vision, the whole lot. So if I'm doing something that you feel discomfort, let me know, okay? Can you close your eyes for me and close one nose? Can you smell? Tell me that what it smells like.
Alcohol.
Okay. What?
Alcohol.
Okay. And that was your sense of smell, and it's intact because I presented alcohol to you to smell, alcohol part. And what I'm going to do next is to have you close one eyes and read out the smallest letter, the smallest number that you can see here.
374258.
Okay, can you do same to the other eye?
374258.
Good. And that was your nerve, cranial nerve 2, and your vision is clear. So I'm going to go ahead and check your cranial nerve 3, 4, and 6. And I'm going to dim the light, and there's a light here. I'm going to flash it into your eyes, and I'm checking for the constriction of your pupils and to see if they're equally constricted, okay? All right. Okay. They were all equally constricted, and I'm going to have you follow the direction of this pen without moving your head. Can you do that? Okay. Okay. So you follow the command and all that. Once I'm done with that, I'm going to go ahead and check for your cranial nerve 5. So I'm gonna have you, touch here, have you open your mouth and close your jaw, good. And I'm gonna have you close your eyes, please. And tell me what it feels like. I'm going to run something on your forehead down to your cheeks. Tell me if it is a soft touch or sharp touch, okay? How does it feel?
Soft touch.
How does it feel?
Soft touch.
Okay. going to check your facial nerve, and that's your cranial nerve 7. So what you're going to do for me is that you're going to smile, raise your eyebrow, puff your cheek. Good. And whilst I'm doing that, I'm going to go ahead and have you, I'm going to check your hearing. I'm going to check your hearing, and that's your cranial nerve 8. So I'll go behind you and I'll whisper some numbers and you say it out loud from what you hear from me, okay?
1, 2, 3.
1, 2, 3. Okay. Good. So I'm now going to go ahead and check the other cranial nerves, and I'm going to have you open your mouth, bring out your tongue, wiggle your tongue, up, bring it out, up, down, bring it out like this, yes, down, yes, and up, and then to the side and to that side. Okay, good. And I'm going to have you open your mouth and I'm going to check your uvula. Say up, up. Okay, good. And I'm going to have, what was the last time you visited the dentist? The dentist?
6 months ago.
And do you have any braces, any dentures? No. Okay, I'm checking for the tongue, any lesions or, okay. All right. Once I'm done with that, I'm going to check your accessory muscles. And that's, I'm going to put my hand here, stretch your shoulders. All right. And pull back, resistance to same here. Good. And what I'm going to do next is to I think I'm done with the cranial nerves, and I'm going to start with the head to toe assessment. So I'm going to start with your head. Have you had any head trauma, any head injuries? Do you have anything of concern on your head that you might want me to know, or your face?
No.
Any cyanosis?
No.
Okay. So I'm going to touch to see if I can feel any abnormal growth. Okay. Do you feel any discomfort?
No.
Any pain?
No.
I'm feeling for lymph node. I can seem to find any. Any obstruction in your nose, difficulty breathing?
No.
No? Okay. So I'm going to go ahead and use the otoscope. Oops, sorry. And I'm going to check your ears, okay? Okay, and I'm going to look inside. See if there's any discharge. And I'm going to be checking your nose. Is any obstruction, any cyanosis on your nose? Do you experience any difficulty breathing?
No.
Okay, open your mouth. Which I already assessed. You said no dentures. You don't have. The last time you saw your physician was when?
6 months.
Your dentist 6 months ago. Okay. Now, once I'm done with that, I'm going to fill your grapes. Squeeze and pull. Okay. And push against resist. Okay. And push. Okay. And pull. pull. Okay, good. I'm going to check for capillary refilling. I'm expecting it, see if it will refill in less than 3 seconds. Okay. And whilst I'm doing this, I'm also checking her skin to see if she has any skin lesions, anything that is abnormal about your skin. And do you have anything of concern about your skin that you want me to know?
No.
Okay, now I want to check skin integral. Okay. So right now I'm going to go ahead and check your pulses. Okay, and I'm starting with your carotid pulse. And I'm going to assess this side to see if there's any jugular vein distension, which there is none upon assessment. And I'm going to auscultate your jugular veins, okay? I mean your carotid. Okay. Okay, this is your brachial pulse, radial pulse, popliteal pulse, dorsal, and pedal pulse. Okay, now that I'm done with that, I'm going to go ahead and I'll listen to your heart sound, okay? And I'm going to start with your aortic pulse, which is located on your second intercostal space, okay? Pulmonic, herb, tricuspid, and mitral pulse, which is also known as PMI, which is located on the fifth intercostal space. Okay. Now I'm done checking your pulses, your heart pulse, your heart rate. I'm gonna go ahead and assess your lung sound. So do you have any concern about your breath, and any difficulty breathing?
No.
No. Any lung problems? Do you smoke?
No.
No. Any history of COPDs?
No.
No. Okay. All right. Take a deep breath. Okay, I'm going to listen to it from your back too. Can you turn around for me? Okay. Deep breath. Okay, so whilst I'm behind you, I'm going to go ahead and check for the symmetry to see if your respiration is equal. When you breathe, the rise and fall at your back is equal. And I'm going to use my hand to see if that is gonna it's gonna support. I mean, to see how your respiration, your lung is expands. Okay, so take a deep breath. Okay, good. Whilst I'm here, I'm checking for the spinal cord, if is whether it is very well aligned or there's any issues. Now, whilst I'm here, I'm gonna go ahead and check your back to see if you have any discomfort. Do you have any issues with your kidneys or anything? Okay, I'll be checking it, and if you feel any discomfort, let me know. Okay. Does it hurt? Does it hurt?
No.
Okay. All right. So I'm going to go ahead and check your let's check your you're going to do the reflexes, range of motion exercises. Do you have any contractures that makes your joints unable to move? No. Okay, so whilst we do it, if you have any discomfort or pain, let me know. Okay. All right. Okay. Okay. We're going to do same to your legs. Okay. Can you wiggle your toes? Let's see. Okay, good. Did you experience any pain? Do you experience any discomfort there? No? Okay. Now I am going to go ahead and check your reflexes to see. So okay. Like that. And I'm going to do same to your knee. Okay. And I'm going to stroke this under your feet, and I'm checking for the Babrisky reflex. Okay. That is negative. So once I'm done with this, I'm gonna have you. What was the last time you have your bowel movement?
Yesterday.
How was it?
It was formed.
What was formed? No worry.
No.
Okay. Was there any abnormalities?
No.
Okay. I want to have you lay down. And I'm going to go ahead and assess your, inspect your stomach and see if everything is good. Okay. All right, I'm going to auscultate your stomach now. And I'm going to listen to your stomach sound using this, okay? Okay. Well, your bowel sound is present and is active, okay? So I'm going to go ahead and palpate your stomach. Tell me, I'm looking for any, if it is hard or if distended, and if you're feeling any discomfort, let me know, okay? So whilst I'm here, I'm going to go ahead and check your bladder, okay? When was the last time you pee?
This morning.
Okay, how was it? The color,
Yeah, it was clear.
the scent, did it smell?
Yeah, it had no smell.
Okay, the normal stuff? Okay, all right, I'm gonna have you sit up. So, at this time, I'm gonna have you stand up. Close your feet. Don't close your eyes. Upright, right, and I'm right behind you. I'm by you. I'm standing by you. So don't be scared. I'll help you if you're about to fall. Okay. Okay. And I'm gonna have you open your eyes, pick up one foot, and then hop on the standing one. Do the same to the other, and hop. Okay. Can you turn around? And I'm gonna have you walk to the side and turn right back. All right. Thank you, Miss Thompson, for your time. Is there anything? You may have your seat.
Thank you.
Is there anything that is of concern that you think I should know? Any medical history that?
No.
Okay. All right. Then at this time, I'm going to go ahead and wash my hands and dress up. And I'll